On the Medical Watch, some confusion about colon screenings.
As our medical reporter Dina Bair tells us, a new study is creating some controversy.
This research could have negative health implications. It was welcome news for people who just don't like the idea of having a colonoscopy. A new study seemingly showing that colon cancer screening is not necessary. But doctors say not so fast. Looking more closely at the data, experts urge people not to cancel their appointment.
Because colorectal cancer at early stages causes no symptoms at all, that's the most common symptom, is nothing.
Rush gastroenterologist Dr. Selena Lee spoke with us in between colonoscopy patients. She knows firsthand the screening finds and removes polyps that can develop into cancer, and regular screenings detect cancer early.
Logically, you can assume, and it is true, that stage for stage in any cancer, if you can find a cancer early, if you can find a colon cancer early, you can offer better treatment options and even cure.
But a study published in the New England Journal of Medicine called the screening into question. Researchers examined patients from Poland, Norway, and Sweden and found the 10-year risk of colon cancer was lower among study participants who underwent colonoscopy, but only by 20%, less than prior studies. And study authors say colonoscopy did not significantly reduce cancer death rates.
What it's saying is that when you compare groups between patients that were invited to receive colorectal cancer screening by colonoscopy versus those that were not invited to get screening, there was no significant difference in death from colorectal cancer. And that is one of the primary endpoints, and it's a very important endpoint.
The consensus among U.S. doctors is the numbers in this new study are misleading. Some study patients did not get colonoscopy. Others were invited to undergo the scan, but only 42% actually got a colonoscopy. Yet information from all of that so-called colonoscopy group was included in the analysis.
If you actually look at the effect of patients who underwent the screening colonoscopy, the decrease in the rate of colorectal cancer deaths was by 50%. It was significant if you look at the patients who actually went through the recommended screening.
The patient population is important as well.
In the United States, the demographics, especially in urban centers, is not going to look like what it looks like in Norway, Sweden, and in Poland.
Age is also a factor. This study looked at 55 to 64-year-olds, ages too late to begin colon screening for meaningful protection from death. In the U.S., colonoscopy is recommended at age 45, and doctors say it does save lives.
Colorectal cancer affects 1 in every 20 people. It is just that common. It's the 4th most common cancer worldwide. It is the 2nd leading cause of death.
The bottom line, doctors say more research is needed since this latest European study is contradictory to what research has shown here in the United States for years. Colon screening is impactful for reducing colon cancer deaths, and there are other options now. Discuss them with your doctor. Don't ditch colon screening altogether. Back to you.